So our first medication was Albuterol, and it was created by Dylan Winscott and Rebecca Popp.
The generic name is Albuterol, and it represents that it is an inhalation-based aerosol. There are a few brand name drugs, which would include ProAir HFA, ProAir RespiClick, Proventil HFA, Ventolin HFA, and Vosfire ER, and there are many more brand name drugs, but these are the most common that we typically see in practice.
The chemical name associated with albuterol is tert-butylamino methyl hydroxymethylene disulfate. Albuterol can be taken either one of two ways. The most common way is through the use of an inhaler, and there are three different types of inhalers that we can see: a nebulizer, a dry powder inhaler, or a metered dose inhaler. A nebulizer is a small device that is used to vaporize liquid medications that will be inhaled.
A dry powder inhaler is a handheld device that holds a dry powdered medication that individuals can physically inhale to get their elicited effects. A metered dosed inhaler uses a propellant to deliver a measured quantity of medication into the lungs. Albuterol can also be administered enterally with the use of a tablet on a designated schedule. Albuterol is a short-acting selective beta-2 agonist. Patients with asthma will have an overreactive immune system, which is causing an inflammatory response to a stimulus or antigen. As a result of inflammation, their bronchioles will constrict and it will make it very difficult to breathe.
In order to reverse bronchial constriction, medications such as albuterol can provide rapid relief for their symptoms. Once albuterol is inhaled, it will selectively bind to beta-2 receptors found in the lungs and elicit the response for bronchodilation. Because these receptors are beta-2 mediated, their inhibitory effects will allow for the relaxation of smooth muscles of the bronchioles, thereby relieving the constricted nature of the asthmatic symptoms. Since albuterol is a selective beta-2 agonist, it tends to have little cardiovascular effects. Once albuterol is inhaled, it is rapidly absorbed into the bloodstream from the respiratory tract. If albuterol is taken in a tablet form, it will be absorbed from the gastrointestinal tract into the bloodstream. For the distribution phase, when albuterol is inhaled, it will quickly bind to beta-2 receptors found in the smooth muscles of the bronchioles. If albuterol is taken in a tablet form, it will typically take longer for the drug to reach its target site. Time of peak effects are usually within 30 minutes. As a side note, albuterol cannot cross the blood-brain barrier.
Albuterol is metabolized in the liver by the SOLTIA3 enzyme, which will convert albuterol into inactive compounds. Generally, the half-life of inhaled albuterol is 3.5 to 5 hours. Tablets will have a half-life of 5 to 6 hours, and the extended-release albuterol has a half-life of 9.3 hours. Typically, albuterol is excreted by the kidneys roughly about 80 to 100% of the time in the form of urine as a primary metabolite or parent compound. It is critical that the patient has their inhaler with them during their time of their appointment. Xerostomia is typically present when albuterol is used. Patients may need daily fluoride treatments if they have persistent xerostomia, and patients could also take salivary substitutes to treat their xerostomia.
If a patient uses their inhaler during the time of their treatment, they may need to rinse their mouth out with water to help alleviate any symptoms that accompany with the dryness. If patients do not take care of their oral health, the xerostomia could cause bad breath, gum disease, and tooth decay. Any patients taking albuterol should be brushing and flossing their teeth at least twice a day. According to our research, there are currently no dental-related indications regarding the use of local anesthetics or any kind of vasoconstrictors with albuterol.
However, there are contraindications for individuals who have a hypersensitivity to albuterol or any other of its molecular components. It is important to be aware of patients with hyperthyroidism, hypertension, coronary insufficiency, cardiovascular disorder, and diabetes mellitus. Take caution with patients that may have unusual adrenergic responses. These are two possible prescriptions that we could see for albuterol. The first one shows a tablet form for albuterol, while the second one shows an inhalation aerosol with an adapter.
Albuterol can also cause nervousness, headaches, unusual tastes, mouth or throat dryness, nausea, and shaking. Albuterol can also cause red appearing lesions and sores on the soft palate of the mouth. If the area goes untreated, it can spread throughout the mouth and down the throat. This is why it is so important to treat these areas during the early stages of their development.
Albuterol was discovered in 1972 by L.H.C. Luntz. Albuterol can cause yeast infections in the mouth, otherwise known as thrush. It may also cause throat pain.
Albuterol can also cause your voice to change, and it is one of the most widely used bronchodilators. Individuals without insurance normally have to pay quite a large sum of money for inhalers and nebulizers. For example, an inhaler can cost up towards $60, and a nebulizer can cost anywhere from $300.
The second drug we will be presenting on is Synthroid.
Synthroid has a generic name of levothyroxine. The name brands include Synthroid, Levothyroid, Levo-T, Levoxo, and Unithroid. The chemical name includes sodium amino hydroxydiodophenioxyl diodophenyl propionate pentahydrate.
Synthroid can be taken enterally in either a capsule or a tablet form. Typically, these medications are taken once a day on an empty stomach approximately 30 minutes before breakfast.
Synthroid can also be given through an IV, usually to treat myxedemacomas. This allows it to bypass the gastrointestinal tract altogether. If you are giving Synthroid to a child, you can actually crush the tablet and mix it with about 1 to 2 teaspoons of water to make it easier for them to consume. Synthroid is used to treat patients with hypothyroidism. However, it does not cure their hypothyroidism. Typically, it can take up to several weeks before any changes are even noticed in an individual. It is always important to consult the physician before stopping this medication, even if the individual is feeling well or if they've noticed their symptoms have gone away altogether. Synthroid is a synthetic version of T4, which is a hormone secreted by the thyroid gland. Upon ingestion, Synthroid is converted into its active metabolite, which is the L-triiodothyronine thyroid hormone. These hormones will then bind to thyroid receptors located all over the body.
Synthroid exerts metabolic effects through the control of DNA transcription and protein synthesis involved in normal thyroid function. It is also known to increase mobilization of glycogen stores. It also increases basal metabolic rates for numerous cells throughout the body. When Synthroid is taken orally, it is mainly absorbed in the small intestines where it can enter the bloodstream. Patients with hypothyroidism would take approximately 3 hours for maximum concentrations to occur. It is important to note that the consumptions of food will alter the amount of absorbed medication. Synthroid is going to be distributed throughout the body through the bloodstream until it reaches the thyroid gland. At the thyroid gland, it is going to bind to those thyroid hormone receptors, and this process will increase the functions of the thyroid gland.
Synthroid is typically metabolized in the liver by the deiodinase enzymes, which convert synthetic T4 into T3. Once T3 has circulated throughout the bloodstream, it can be further reduced in the liver by the same deiodinase enzymes. Thyroid hormones are also metabolized with interactions with sulfates and glucuronides. Generally, the half-life of Synthroid for hypothyroidism is 9 to 10 days. The onset of actions takes approximately 3 to 5 days, and the peak therapeutic effects require 4 to 6 weeks. Synthroid is excreted directly into bile and into the gut. However, Synthroid is normally eliminated through the kidneys in the form of urine. If the patient is not consistently taking their medications, such as Synthroid, they would be considered to have relapsed into hypothyroidism. Caution should be taken when administering local anesthetics, because blood toxicity could be more easily achieved. Individuals with hypothyroidism can easily overdose on medications because of their lack of normal metabolic rates.
But if a patient is taking their Synthroid medications regularly, there will be no dental-related side effects. As of right now, there are currently no dental-related indications of Synthroid. Contraindications of Synthroid are included in patients who may be allergic to the ingredients in the tablets or capsules.
Furthermore, Synthroid can cause cardiovascular effects and can increase liver enzymes. It can also decrease bone density while increasing bone resorption. It would be important to monitor the patient's heart rate and blood pressure during their treatment. Secondary drug interactions may affect dental procedures because of their cardiovascular health and blood clotting abilities. Here are a couple examples of prescriptions that may involve Synthroid and levothyroxine, the generic name. On the image on the left, you can see a Synthroid medication at 0.75 milligrams, and on the right, you can see a levothyroxine at 0.15 milligrams.
A patient that is not taking their Synthroid medication and has hypothyroidism may experience gum disease, an enlarged tongue, sores in the mouth that cannot heal very quickly. Slow tooth development can also be seen in children.
Patients may also experience low blood sugar. They may be at an increased risk of oral infections. Individuals with hypothyroidism may experience xerostomia. And individuals may also experience a burning mouth syndrome because of their thyroid issues. Foods such as nuts, whole grains, and seeds that are high in dietary fibers will make Synthroid overall less effective. It is highly recommended to not drink coffee while taking Synthroid because it will also make it less effective. Patient adherence will make Synthroid much more effective, and some interesting facts is that patients who keep up on their medication will most likely not be diagnosed with a bipolar disorder, with depression, or with diabetes.
Patients that are over 65 years old are at an increased risk of death because of their hypothyroidism, versus those that are on their Synthroid therapies. There has also been experiments and studies done on rats that have Alzheimer's disease. Scientists have been injecting levothyroxine in low doses into those rats. The results of the study show that the rats' brain deficiencies have improved.